And today, the fight was on with county supervisors over a vote for vaccinating police officers, moving them up on the vaccination tiers.
News 8's Brandon Lewis has the story.
Now, Carlo and Marcella, this simply didn't have the votes of Democrats and wasn't supported by Public Health Officer Wilma Wooten. The resolution was put forward by Supervisor Joel Anderson, who argued that he wanted law enforcement to get the vaccine because they are putting themselves more at risk, but it wasn't supported by some essential workers who called into the meeting.
How can we possibly exclude our law enforcement when they are critical to many parts of the county?
Supervisor Joel Anderson put forward a measure to prioritize the county's law enforcement officers in line to get the coronavirus vaccine. He says they often put themselves in harm's way and risk getting or spreading the potentially deadly virus.
If they're struck down by COVID, yes, they, like firefighters and other physically fit young people, they're not likely to die, but others may die because they weren't there to protect them.
The idea gained momentum in recent weeks as more chiefs and department heads spoke up, but it faced opposition from callers at the meeting who said law enforcement is no different than other essential workers who are part of Phase 1B. EMTs and cross-trained firefighters got their vaccines early only because they can now vaccinate others. Police officers cannot.
Police officers are no more important than those workers and should not be skipping the line while everyone else is still waiting for their turn.
Previously, county officials claimed they were following state guidelines, which places officers and deputies in a lower tier. But this week it shifted, saying they want to reserve vaccines for the most vulnerable. Public Health Officer Wilma Wooten compared them to those who can get vaccinated now, saying officers make up less than 1/4 of 1% of all cases and even fewer of the deaths.
While no death is insignificant, our 65 years of age and older represents 79% of all of those individuals that have died, while we've had 2 deaths with law enforcement attributable to COVID-19, which is 0.1%.
It's worth pointing out this was only a recommendation. It was not a mandate to vaccinate law enforcement. That decision, had this passed, would have rested with Public Health Officer Wilma Wooten, who did not support the measure today. Carlo and Marcella.
Thanks, Brandon. And we're asking tonight, should vaccination be based on age or occupation? You've responded on social media. Tammy Padilla on our Facebook page said both should be taken into consideration. Susan L. Peters-Baker says age and health conditions. Occupation, she says, shouldn't matter. I'm in Tier 1B and would give up my spot for another who needs it more. Elaine Ludlam-Dye, vaccinate over 65 and teachers ASAP. Cindy Mack says in tiers, in orders, health, age, and occupation are the priorities she thinks we should be making them. And Julie G. Leonard says underlying conditions should be at the top of the list. We've heard many varieties of all these sentiments on our social media platforms, and you can still weigh in on any of our social media platforms. And thank you to all of you who've already chimed in on this conversation.